is the worst. This is the worst, yeah. And I did get the flu shot.
Misery as thousands with the flu flood hospitals. At Swedish Medical Center, a separate waiting area is set up for patients with flu-like symptoms. There are face masks, hand sanitizers, and a reverse airflow fan. Denver Health also opened a separate sick bay for flu sufferers. Scientists are investigating whether a second B strain that the vaccine doesn't protect against is surfacing.
So even if it's not perfect, though, doctors say the vaccine is still the best protection.
If you got the flu shot and you still get the flu, it'll probably be a milder case than if you hadn't gotten a flu shot at all.
So here is a look at the newest numbers from the State Department of Health. More than 500 people hospitalized with the flu. This is as of Saturday. That's compared to last year when there were 543 cases the entire flu season. So we're almost there already. 2 toddlers in Colorado have also died from flu complications this year. It's
a bad situation. And Dr. Dianne McCallister joins us every Wednesday. She's here again this morning. We're glad you are because this is a hot topic. Now, you're the medical officer, chief medical officer at Centura Porter Health, and we've talked about the changes, the drastic measures at Swedish and Denver Health. What is Porter doing to deal differently with these patients?
So we also have hand sanitizer, and we ask people who have flu-like illness to put on masks when they come in our waiting areas to protect the other patients. We try to move them into rooms as quickly as possible. And then we all have plans if there becomes too much flu to start triaging them actually outside of the ER in tents so that we can take care of more patients more quickly. We haven't instigated that, but in the East Coast, they have put those plans into place.
It's such a tough season. We were talking to people in the newsroom today. It seems like everybody and their spouse at their workplace has something that everybody's passing around. How do you know if it's the cold or just some kind of respiratory thing or the flu?
Well, generally, when you have the flu, you feel like you've been hit by a Mack truck. And when you have a cold, you feel okay. You get high fevers, usually 101, 102, severe body aches. You're extremely tired and basically don't want to get out of bed. And then you get a dry cough.
Okay.
Well, and people are miserable. We are hearing from people, even those who have had the flu shot this year, that they're getting sick, and there may be a new strain of flu. Why is this happening?
Well, you know, every year the experts in disease control look at what's happening over in China and the Southeast Asia and make a decision on what flu vaccine to create. Now, the flu what turns up here may be different, and this year we are seeing a B strain that about 30% of the B strain cases are turning out to be this not covered by the vaccine, but they have to decide what the vaccine is about 9 months to a year in advance, so they just make their educated guess.
They come up with that vaccine so it's in here and ready when the season hits. So it's hit, and some people are still getting sick. If at this point you hadn't had the flu shot, is it still worth getting?
It is absolutely worth getting. Most of the strains that we're seeing in Colorado are covered by the vaccine, and it takes a couple weeks to get your immunity up, but every day after you have the shot, you're getting more and more resistant to the flu.
Okay. Now, you mentioned hand sanitizers earlier. Are there some other simple steps or maybe complicated steps that we can be taking to protect ourselves and our families?
Well, you know, getting enough sleep, staying at home and asking your coworkers stay at home when you're sick. People should be, if you are sneezing or coughing, you should cough into your elbow so it's not on your hands where you're touching people, and wash your hands all the time and keep your hands away from your face. We usually touch our face thousands of times a day, and that's how we get it, so keep it away.
My hands are raw from washing them so much, but I'm trying not to get the flu. So with an increased number of people needing attention and they're heading to the ER, how do we know when it's time for us to maybe seek help at the ER?
Well, in general, if you start getting the symptoms of the flu, it's a good idea to call your primary care physician, and there are some drugs we can give in the first 48 hours that will help decrease the symptoms. Secondly, if people are having difficulty breathing, if they have a really high temperature, if they're getting dehydrated and not urinating, then they need to be going to the ER, because a lot of times it's the complications of the flu. The other thing is, if you've had the flu and then start getting sick again and are, you know, coughing things up, it's time to get checked. But if you're short of breath, go to the ER.
Okay. Right. Be safe.
Wise words. Thank you so much, Dr. Dianne McCallister.
You're welcome.